Welcome to Nasdaq TradeTalks. I'm your host, Jill Malandrino, global markets reporter at Nasdaq. Joining me is Teemu Suna, founder and CEO of Nightingale Health Plc. We're here to discuss building sustainable healthcare and reducing health inequities. It is great to have you with us, Teemu. Welcome to Trade Talks.
Thank you. Thank you for having me.
You got it. And Nightingale's, your mission is to build sustainable healthcare, make it equal and accessible for all. Can you tell us more about your business and what was the genesis behind it? What was behind starting Nightingale?
Yeah, sure. So the starting point of Nightingale was to solve the world's largest healthcare problem, which are the chronic diseases. To give a bit of context, if we look at the healthcare today, the healthcare spending is around 17% of gross domestic product in the United States. And to compare, the military is somewhere between 3 and 4%. So healthcare is like a massive, massive problem. And out of the annual spending in the US, around $4.5 trillion, 4 trillion is with the chronic diseases. And the problem why we are in this situation is that our healthcare system is actually, it's not healthcare system, it's a sick care system. To solve this problem, we founded Nightingale because we need, in parallel of the sick care system, we need a system that can prevent the disease from emerging. So what we have created a novel way of testing blood samples. We only need one blood sample and we can detect the risk of developing the most important different chronic diseases. And when we can detect the risk early, we can take preventative actions and we can actually prevent the disease from emerging. So it's a kind of a way to think about the healthcare system in a novel way.
Recently, you transferred from First North to the main market, becoming the 140th company to make the switch. What motivated you to transfer to Nasdaq Helsinki main market?
Yeah. So if we look at healthcare and if you look at the problem that I was talking about, this is a problem that is not a problem in a single country. It's a problem that it's in all of the Western world, in all of the developed countries. We have the same problem. So Nightingale is a very global company, and then making the move from the First North to the main market is part of our capital market journey to make the stock more better available for a broader group of investors.
In February, Nightingale Health announced the development of an innovative LLM-based tool to empower individuals to make informed decisions to lower disease risk. How do you envision this tool transforming the healthcare industry?
Yeah, well, when we look at the chronic diseases, another word for the chronic diseases like cardiovascular disease, type 2 diabetes, kidney disease, liver disease, is we can also call them like lifestyle diseases. And then when we look at lifestyle is something that it doesn't happen when you see the doctor. It happens every moment in your life. And because of that, we need to change the thinking in healthcare and empower people better to do better actions, to choose better lifestyles. And for that, the language model tool that we are building, I think it's a perfect solution. And then with our technology, because we can detect the actual risks. I mean, anyone can go to ChatGPT and ask like lifestyle guidance. But the difference with our technology is that because we can actually detect your like individual risks. Then we use the language models to provide the guidance. And this guidance is actually personalized to your situation. And then with further blood testing with Nightingale's technology, you can actually see your trajectory if your risks are going down. And with that, you are less likely to develop the diseases in the future. So the tool is all about empowering people to take better actions in their like daily lives.
What are the future plans for Nightingale Health in terms of expanding its disease risk assessments and health check product line?
Yeah. Well, I think there is another big shift coming up in the healthcare industry, and I think if we look at the current healthcare industry, it's very centralized system. So whenever you want to have your risk evaluated for a chronic disease, you have to go into a healthcare facility. So what we actually believe is that the future of healthcare, it will be more distributed system. So healthcare will become a more distributed system. And Nightingale has a technology where you can actually provide the sample at home by people themselves. You can provide the sample, the blood sample at pharmacies. You can provide the sample anywhere. And then when you provide the sample, Nightingale will analyze the sample, and then you can utilize, for example, telehealth providers or any parts of the existing healthcare systems or well-being system to get support and help with your lifestyle. So I think the next big thing we are building is kind of transforming the healthcare system from the purely centralized model into a more decentralized system.
All right, Teemu, appreciate the insight. Thanks for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.